The kidneys, those small but powerful organs located in the lower back, are silent heroes that work tirelessly to keep us healthy. However, sometimes they can get sick, which can significantly affect our quality of life. In this video, we will explore the world of kidney disease, from its causes and symptoms to treatment and prevention options. We will learn how our kidneys work, what happens when they fail, and what we can do to protect them. Our kidneys are our natural filters that clean the blood. Every minute, they process about a liter of blood, removing waste, toxins, and excess fluids. The kidneys also help regulate blood pressure, produce red blood cells, and maintain electrolyte balance in our body. They are essential organs for our general health. The danger is that, in most cases, kidney diseases are diagnosed in very late stages. But why does this happen? Not many people are knowledgeable enough to know that kidney disease symptoms can be silent. Kidney disease, also known as nephropathy, is characterized by the gradual loss of kidney function. Unlike other diseases, this condition can go unnoticed for a long time, as its initial symptoms are usually subtle and easy to ignore. In the early stages, kidney diseases may not present any symptoms. In some cases, symptoms may not even occur until the condition is critical. This makes knowing and recognizing the symptoms much more crucial, which is why we bring you 12 signs of kidney disease that should be taken into account. 1. Change in urinary habits. Changes in urinary habits can be the first indication that something is not right in our kidneys. Although they are often associated with other conditions, these alterations in the amount and frequency of urine can be the silent signal that warns of the presence of kidney disease. How can we identify these changes if we experience an increase or decrease in urinary frequency? For example, if we urinate more frequently than usual, especially at night, or, on the contrary, experience a decrease in the amount of urine, these may be warning signs. Changes in urinary habits are one of the first signs that the kidneys are not working properly. Although they are often associated with other conditions, these alterations in the amount and frequency of urine can be the silent signal that warns of the presence of kidney disease. Another change that we must take into account is in the appearance of the urine. If it becomes darker or cloudy, it is time to consult with your doctor. Another symptom that you should take into account is if you experience an extreme urgency to urinate, but when you get to the bathroom, you find it impossible to do so. This situation can generate great discomfort and frustration in the person who suffers from it. In some cases, it can even lead to abdominal or lower back pain. This inability to urinate can be caused by various factors, such as urinary retention, urinary infections, such as cystitis, kidney stones, but also, in the case of men, it can be due to prostate pathologies. 2. Difficulty or pain. When urinating, difficulty, pressure, burning, or pain when urinating could be signs of a urinary tract infection. It is usually very uncomfortable. We may experience discomfort, such as burning, itching, or frequent need to urinate in small amounts. This condition is common, especially among women, due to the anatomy of the female urinary tract. It is characterized by inflammation in the urinary tract, generally caused by bacteria that enter the urinary tract and multiply in the bladder. It is important to see a doctor to obtain an accurate diagnosis of the agent that is causing the infection and the treatment to follow. This is easily curable, but it is best to detect it early. Urinary infections without proper treatment can spread to the kidneys. This complication, known as pyelonephritis, can be serious and require hospitalization. 3. Blood in the urine. This is one of the symptoms that cannot be ignored and is a direct cause for concern. So don't ignore it. If you notice blood in your urine, it is important to make an appointment with your doctor as soon as possible. This symptom may be a sign of a kidney condition, such as a urinary tract infection or kidney stones. In some cases, blood in the urine can also be a sign of serious kidney disease, such as glomerulonephritis, which is an inflammation of the glomeruli, the small kidney filters that remove waste and excess fluid from the blood. It may also indicate the existence of bladder cancer. Early diagnosis and treatment are crucial for a good prognosis. 4. Frothy urine. Known by the medical term proteinuria, it can be caused by a variety of factors, some of which are harmless, and others which may indicate a more serious underlying medical condition. Some common causes may be dehydration, intense physical activity, which can cause the temporary release of protein in the urine. You may also notice that when you urinate immediately after waking up or after lying down for a long period of time, your urine may be foamier due to protein buildup overnight. Another cause may be consuming protein-rich foods or certain medications, such as those prescribed for blood pressure, may cause a side effect of foamy urine. But there are also less common causes of foamy urine, to which greater attention should be paid, and which can be considered kidney diseases such as inflammation of the glomeruli, which are responsible for filtering waste and excess fluid from the blood. It is important to remember that only a doctor can determine the underlying cause and the appropriate treatment for your specific case. 5. Swelling or edema. The kidneys, vital organs, are responsible for filtering the blood and eliminating toxins, excess fluids, and other waste from the body. When they fail, these harmful elements accumulate in the body, which can cause serious health consequences. Edema, also known as swelling, is an abnormal buildup of fluid in the body's tissues. When the kidneys are not working properly, they can retain sodium and water, causing fluid to build up in the tissues, especially in the legs, ankles, feet, and around the eyes. This condition is known as renal edema. Some pathologies that can be reflected as renal edema are diseases that affect the glomeruli. When these small kidney filters, they are damaged, allowing blood proteins to leak into the urine and fluid leaking into surrounding tissues. Chronic and acute kidney failure are also conditions in which the kidneys gradually lose their function or in extreme cases stop functioning, causing the rapid accumulation of fluid in the blood, causing edema. 6. Extreme fatigue. The kidneys are not only responsible for eliminating waste and toxins from the blood, but also play a vital role in transporting oxygen throughout the body. They do this through the production of a crucial hormone called erythropoietin, which acts as the fuel that drives red blood cells to fulfill their mission, carrying oxygen to every corner of the body. Erythropoietin is a fascinating hormone that plays a fundamental role, and the kidneys, by producing this hormone, become a kind of energy factory for red blood cells, ensuring that every cell in the body receives the oxygen it needs to function properly. Without this hormone, red blood cells would be deprived of the energy needed to adequately transport oxygen. This could lead to a condition known as anemia, characterized by fatigue, weakness, and shortness of breath due to oxygen deficiency in the tissues. Fortunately, there are treatments for anemia caused by erythropoietin deficiency. In some cases, dietary changes or iron supplementation may be sufficient. In other cases, it may be necessary to administer synthetic erythropoietin. 7. Dizziness and inability to concentrate. When the kidneys fail in their primary function, filtering waste and toxins from the blood, the consequences are not only limited to the physical body. Fatigue, a common symptom of kidney disease, also has a significant impact on the brain, depriving it of the vital oxygen it needs to function properly. This can cause dizziness and lack of concentration. The reason is that when the brain lacks oxygen, it works slower. Imagine the brain as a complex and sophisticated organ, similar to a high-tech computer. Just like a computer needs electrical power to function, the brain requires a constant supply of oxygen to perform its cognitive functions. The kidneys, by removing carbon dioxide and regulating red blood cell production, are responsible for maintaining this vital flow of oxygen to the brain. However, when the kidneys fail, this oxygen supply chain is disrupted. The accumulation of waste and toxins in the blood, a consequence of poor filtration, makes it difficult for red blood cells to absorb oxygen. As a result, the brain receives less of the oxygen it needs, causing dizziness, inability to concentrate, and decreased cognitive function. 8. Feeling constantly cold. When the body becomes anemic, which can be caused by kidney disease, it can also cause you to feel cold in warm areas. Pyelonephritis, also known as a urinary tract infection, usually starts in the bladder and then ascends to the kidneys through the ureters, the tubes that carry urine from the kidneys to the bladder. Pyelonephritis can cause back or side pain, fever, chills, nausea, and vomiting. There is no sure way to prevent pyelonephritis, but you can reduce your risk by taking steps to prevent bacterial infections. This includes washing your hands frequently, drinking plenty of fluids, and avoiding unprotected sex. Also, important to urinate frequently and empty the bladder completely. Avoid drinking caffeine and alcohol, which can irritate the bladder and increase the risk of infection. 9. Skin rashes and itching. These are symptoms that are often associated with allergies or skin irritations. However, in some cases, these discomforts can be an indication of more serious kidney disease. It is important to pay attention to these signs and consult a doctor for an accurate diagnosis. While allergies are a common cause of rashes and itching, they are not the only possibility. Kidney disease, particularly in its more advanced stages, can manifest itself through various dermatological problems. Among the most important are uremic rashes that are characterized by small red bumps or pustules that are intensely itchy. Dry, flaky skin is manifested by the kidney's inability to regulate fluid and electrolyte levels in the body, which can lead to dry skin, making it more prone to peeling and itching. Another symptom of advanced kidney disease is intensive pruritus, a severe itch, which can affect the entire body or be localized to specific areas. This itching can be so intense that it interferes with the patient's sleep and quality of life. 10. Ammonia and metallic breath. Kidney failure, a failure in the function of the kidneys to filter the blood and eliminate toxins from the body, can manifest itself in various ways. One of the lesser-known signs, but which can be an important clue, is bad breath with a urine-like odor, also known as ammonia breath. Why does this bad smell occur? When the kidneys fail, urea builds up in the blood, reaching higher levels than normal. Some of this excess urea is filtered through the salivary glands, mixing with saliva. Saliva, normally odorless, becomes an ideal medium for the action of bacteria that decompose urea into ammonia. This is a high alert symptom. Ammonia breath can be an early symptom of kidney failure, even before other more obvious signs such as bloating, fatigue, or changes in urination appear. Therefore, paying attention to a persistent change in breath, especially if it is accompanied by other symptoms, can be crucial for a timely diagnosis. 11. Nausea and vomiting. If your kidneys fail, you will experience constant nausea and vomiting. The reason for this is that the buildup of waste products needs to leave the body, causing vomiting. Imagine a filter system that becomes clogged, unable to remove impurities from the water. Similarly, when the kidneys fail, their ability to filter blood is compromised, resulting in a buildup of waste products and toxins in the bloodstream. Faced with this situation of internal poisoning, the body desperately seeks a way to get rid of these harmful substances. One of the escape routes that the body uses is the digestive system. The stomach, detecting the presence of toxins in the blood, sends signals to the brain that trigger nausea and vomiting. It is important to note that the nausea and vomiting associated with kidney disease is not due to a digestive problem itself, such as indigestion or a stomach infection. Persistent nausea and vomiting, especially if accompanied by other symptoms such as fatigue, bloating, changes in urination, or loss of appetite, may be a warning sign that the kidneys are not working properly and require specialized medical attention. 12. Difficulty breathing. If kidney disease has become severe enough, it can cause a buildup of fluid in the lungs that can make you feel short of breath. Kidney disease, in its more advanced stages, can have consequences that go beyond the kidneys, even affecting respiratory function. One of the most serious complications is fluid buildup in the lungs, a condition known as pulmonary edema, which can cause a feeling of shortness of breath and make breathing difficult. When kidney disease causes pulmonary edema, fluid builds up in the spaces between the alveoli, the small air sacs that allow the exchange of oxygen and carbon dioxide. This excess fluid makes it difficult for the lungs to expand and contract, limiting the amount of air they can absorb. If you experience difficulty breathing, especially if it is accompanied by other symptoms such as bloating, fatigue, changes in urination, or chest pain, it is essential to see a doctor immediately. Early diagnosis and appropriate treatment of pulmonary edema and underlying kidney disease can help control the condition, prevent serious complications, and improve quality of life. And it is important to remember that if you have any of these symptoms, it does not necessarily mean that you have kidney damage. Many of these symptoms are part of other diseases and infections, but it is worth investigating them or consulting with your doctor. This can save your kidneys and potentially your life. Every pathological condition of our body has a cause. In the case of kidney diseases, there are various factors, such as diabetes, high blood pressure, infections, urinary obstructions, autoimmune diseases, and excessive consumption of certain medications. While some causes of kidney disease cannot be prevented, there are many things you can do to reduce your risk, such as controlling your blood pressure, maintaining a healthy weight, not smoking, eating a healthy diet, drinking plenty of water, and exercising regularly. If you suspect that you may have kidney disease, the indication is that you go to your doctor. During the consultation, he or she will ask about your medical history, perform a complete physical exam, and order tests such as blood and urine tests, ultrasounds, or X-rays. If you have any risk factors for kidney disease, it is important to talk to your doctor. Early detection and treatment can help prevent or delay the progression of the disease. Treatment for kidney disease will depend on the cause and severity. In some cases, lifestyle changes, such as a healthy diet, blood pressure control, and regular exercise, may be enough to control the disease. In other cases, such as chronic kidney disease, a progressive condition occurs, and as it progresses, the kidneys lose their ability to function properly, which can lead to kidney failure that will require more advanced medications or treatments, such as dialysis or, in extreme cases, kidney transplant. Kidney diseases can affect people of all ages. Early detection and treatment can help control the disease and improve your quality of life. Remember, your kidneys are vital to your health. Take care of them and live a healthy life. Feel free to share this video with your family and friends. Education and early detection are the best weapons to prevent and combat diseases. Do you have any advice or opinion that you want to share with us? We read you in the comments. That's it for our video. If you liked it, give us a like and subscribe so you don't miss any content. Thanks for joining us.